Linda? I'm a little bit blind, so sorry.
We still have plenty of food, and now we have snacks for the afternoon too. So thank you
Please
very
help
much, all of our donors. Make sure we
Absolutely.
get some treats.
Yes, that's either the book or the bags. Okay, good. Monica Aguirre? Present to win.
Present to win.
Lupe Padilla? Sorry, you don't need to be handing the bags. They're good bags.
They are good bags. And everyone knows what pink represents, right? Breast cancer.
Purple.
That color of purple is what represents Alzheimer's disease. So we need to be everywhere as much as pink.
Cynthia? Norman?
All right.
Yay! You just want to get one in here? Once we're done, I think everybody's going to make a mad dash for that work. Thank you. Richard Maldonado. Gone. Marcy present to win. Elva Robinette. Yay! Thank you for playing and thanks for coming, and we'll continue with the extra panel.
Virginia?
Oh yeah.
You lost her? Bueno, pregunta. She's hard to lose. Oh. She turned it off, or whatever. I guess it was in some ice. Oh, there's Yvonne.
So what we thought we would do to finish out the day is to invite all of our speakers for the day to come up and so thank you very much, Dotty, Dr. Rigney, Virginia, Dr. Lozano, she'll be right back. And to really have an informal, we have an hour to go. I know it's been a very full day. We hope that it's been a very helpful day. And again, we very much appreciate that you spent your day with us. If you guys have questions, if there's something that you feel like you really wish you would have said and didn't get it done in your time frame or anything like that, we are yours for the next hour. And wholeheartedly, once again, want to say thank you to all the donors, all the sponsors. It is really important to know about these resources in your community, even if you think, oh, I'll never need that. Just never know. So we are so appreciative that you're here to share your resources with us and to help underwrite the cost of this. So many, many thanks. And also to all the volunteers here that coordinated this. So we're very, very appreciative. And we're going to share the mic, although I know Dr. Lozano doesn't usually need a microphone, nor myself. Hello.
I'm embarrassed now.
She has no problem. Her voice reaching the back of the room. So we're open. Let me do this. If you all pass the microphone, and if you have something that you thought about afterwards and wish you had covered, let's start with that.
Well, I really appreciate Dr. Lozano just capturing the essence of the caregiver again, because I think that you can't state that enough. Caregivers taking care of themselves. And one of the things that you said today that I just heard yesterday in one of our recordings was that if someone is in a nursing home, for instance, and it takes how many caregivers to care for that one person 24/7, and yet as a caregiver, as a family caregiver, you're the one and only one in trying to do this enormous task all by yourself. So it's really, when you think of it in those terms, it's so important because there's no way one person can handle all of it. And we do have to depend on others. We do have to have a support group. And many times we automatically assume that it's going to be our family members. It's not always the case. So you do have to look for other resources that are available. Knock on your neighbor's doors. There's other people who are doing caregiving that you could even switch, just like parents do with their children. You know, you switch around. You can do the same thing. Be creative about being a caregiver. Thank you.
I really enjoyed Dr. Lozano's talk, and a couple things came to mind, and the one where you said with all your training and everything, still sometimes nothing works, and that's true. So when I'm in those situations, I just remember from football, you take what the defense allows, and you know what that is. You just have to take what they're willing to do. Take what the defense allows. Otherwise, you're not going to get anywhere. And there was another one. Ronald Reagan, when we had this discussion of dementia. Well, actually, when we had a free press, Doonesbury, go back to the late 70s. Doonesbury, I mean, in those days, reporters could say what they wanted. They weren't micromanaged from the White House. So Doonesbury had this guy, Roland Headley. He had a microphone. He was in this cave. He says, "Here I am, inside Ronald Reagan's brain. I'm looking for company." Now, he was onto something. We knew there were some short-term issues in memory with Ronald. We knew it. But it was well hidden. And he had a strong moral compass. All right? So, there's some things you can do. Right? You can still do it. So I thought of that. You know? It'll come to me.
We'll give you the mic back, that's okay. I can't, a couple of things. One is, and sitting here next to the doctor also reminds me that not just waiting for hallucinations or psychotic events, but there are other times that you really need to rely on the person you're caring for's physician to help you out in regards to medicinal assistance. And not to be afraid of that, have conversations, see not everything's going to work. Not everything's going to work without side effects, so it's a really strong trial and error situation that you need to keep seeing what's going to work. So keep that in mind too, that you have that support. And of course, always make sure that you're taking care of yourself as well in regards to, I think that's happening. But more than any of that, I think that one of the things that helps me to connect to caregivers is not only that I have that experiences, but that I use humor. And the humor is what keeps me going on a daily basis. And whether that's working with my mother or my family or just bad drivers. There's a lot of people out there who bug me. And so, for different reasons. So I think that using humor, that you can do it without making fun of someone. I think you can do it with just laughing about yourself and your reaction. But at the end, in closing that, I think also make sure you have what I call 3 o'clock in the morning friends. That you have people you can count on in your life that you can call at 3 o'clock in the morning and say, I just need to talk for 15 minutes. I just need to run something by you, or I'm just losing it. Can you come by and help me? And not the ones that are going to hang the phone going, what the heck are you doing calling at 3 in the morning? But someone that's going to help provide that support for you. So I hope that you can, if you don't have those people, find them and find them quickly. So.
Y'all have given us some great information today. We really appreciate it. The only reason I'm sitting up here is I was to represent community resources. So as I introduced myself earlier, I'm a Wesley nurse, and I consider myself kind of a connector of the dots. Body, mind, and spirit, family, individuals, community. Trying to find resources and referrals for people, doing a lot of health education. And just kind of want to let you know that I'm available. And not so much that I provide the services, but I can help people find those services. And there are a lot of people in the room here locally that also provide services for people with Alzheimer's. Someone asked me earlier about a support group. Country Place Living has a support group on Tuesday nights at 6 o'clock. So take advantage of that, or if you know someone excuse me.
The fourth Monday of the month. Every
Fourth Monday of the month at 6 o'clock. So if you know somebody or if you want to participate in a support group, please take advantage. Tiny Ortiz at the hospital with Heritage. They say individuals that might have early dementia. So there are resources available to everyone in the community. And like I said, a lot of what I do is trying to help people find resources. So like I said, that's my primary reason to be sitting up here with all these experts.
Also, on a note of support groups, we started a couple of years ago, the Alzheimer's Association started a nationwide telephone support group. And it is on the first Monday of every month. And although it sounds a bit odd because when you're on the phone, you can't see someone nodding and you can't necessarily, you're not sitting with someone and feeling that, but we've had people call in from any, we have a woman from Vermont who attends every month, Louisiana, Florida, and it is incredible. We meet for an hour and a half. And you think, oh my gosh, particularly on the phone, how do you talk about that whole time? But everyone just shares, you know, what their most difficult thing is that they're experiencing that week or that month, or do you ever have this happen? Or I feel so guilty because, you know, just all those things. And by the time that hour and a half is done, everyone says, wow, I just really appreciate that you gave me those ideas. I hadn't even thought of that. Or just thank you so much for listening. So no matter what, we do try to just hammer this home that no matter what, no matter where you live, if you have a phone, you can definitely talk with other people who understand and who have a listening ear, whether it's the telephone support group or just the helpline of the association. I think it makes a significant difference. I love my friends, and I even think about myself. When I worked at the association before this, I've learned so much more now going through this personally, and one of the most helpful things is to be able to talk about it with someone who understands. Who, when I say, wow, I feel really guilty because she did this, and this is how I reacted, and I know not to do that, and I got caught in the moment, and I did it anyway. And just to be able to share that with someone, that's really helpful. So I think that's one of the main things about support groups is you find out you're not alone and that you are in a situation where you can pretty much say anything and you're not going to get judged. You're just going to get someone who understands, yep, I know what that feels like because I did that too. So that's another resource for sure. Any questions?
Are there any, I guess, promising research studies regarding prevention or treatment?
I can give you my information. Do you want to take that first?
You go ahead.
Okay, so here's a resource where you can go and get information. The national website of the Alzheimer's Association is alz.org. Super easy, alz.org. And if you put /research, /care, /driving, /wandering, any type of word after that, it'll call up information. And there's research information that you can get from there, the latest and the greatest. And it's also easier to understand, I think. Here's what happens. A study will come out and the media will pick it up and then it'll go on the media and people will call our office and go, hey, we heard on the news there's a way to prevent this or you can get a diagnosis through doing a smelling test. Well, the first thing we do is we go to alz.org or we call our national office on our helpline and say, okay, give us the talking points, and usually they'll send them out to us ahead of time. You don't even have to ask. And it'll say, here's the information behind this particular study. It was, kind of a weird word, but it was vetted through our National Scientific Research Board, and yes, it was viable, and yes, it's going to continue. They're going to keep looking at that particular thing. Or this was a study that was done on 10 people in you know, and that it's just really not a reliable source of information. So, just thinking about, go ahead.
Also, I want to mention that one of the things that I think is consistently showing over and over again in that last talk we did with Dr. Royal and that group in San Antonio was that early detection is critical. Getting tested early. We have someone at the Alzheimer Association now whose wife has Alzheimer's. She's 41. And so, but the early detection is where they're able to do a little bit more work with that person. Not curing it, but there's some interventions that help can slow the process. But right now there are no cures, which is why we need so much support for research dollars. If you can help, you know, with Alzheimer's Walk, whatever you can do, all those things all play a part in helping. Remember, this is how Susan B. Komen got started. This is how, you know, all those, the MS Walk, all those things get started. The more people that start coming forward, the more money we can get for those research dollars, the better we can hopefully be able to find more intervention or more caregiver dollars too, for caregiver support.
I also, just regarding research, sometimes, like, well, I'll use myself as an example. I used to hear the word research and think, okay, that's off in Sweden somewhere. What in the world, you know, what does that mean? How is that going to help us, or what is that doing? And actually, there are research studies that are done across almost every state, not just in the world. And I love this brochure because it does talk about, also you think about, okay, they do research on genetics, on families, why in a family of 7 do 4 siblings develop Alzheimer's and 3 never have anything. They do studies like that. But they also do, what am I trying to think of? Quality of care studies. They study, you know, that being in an environment like what Dr. Lozano was talking about repeatedly, being in a routine is that can actually be extremely helpful for an individual, and looking at quality of life and taking care of someone with Alzheimer's disease, how to put that in a study that by research, so that not only can we say that that's true, but it's a proven way of taking care of individuals, that if you have a routine and you have specific time frames for things. And just not finding what I wanted. Okay, here we go. So types of clinical trials. These are different kinds of research that they do. Treatment trials, which means new treatments or combination of different treatments. I know the last time I was lucky enough to get to go to a national meeting that we had, there's talk that similar to AIDS as a disease, there's not a cure necessarily, but there's a cocktail of treatments that someone can take with AIDS, and it allows them to live out the rest of their life. So they no longer would say, I have AIDS and I'm going to die, but it would be, I'm going to live out the rest of my life with this. That Alzheimer's is possibly going to be very similar to that, in that it would be a cocktail of treatments and medications that someone would be able to say, I have Alzheimer's disease and I'm not going to die from it. I'm going to live out the rest of my life in this area of the cognitive abilities that I have. So diagnostic studies, trying to figure out how to diagnose. Since we still, there's, like we talked about today, there's no one diagnostic test for this disease as compared to a lot of others, and that makes it really tough. So they're trying to figure that out. Prevention trials, investigating ways to prevent the disease. Screening studies, testing methods to identify diseases or conditions at the earliest stages. And then quality of life studies, where they do look at caregiving and family caregivers and all of those types of things. So I don't know if Maxine might have touched upon this earlier during lunch, but I kind of make a joke about it, but research, a lot of research related to Alzheimer's disease starts in mice, but there are only so many mice before research studies need to get to the point where they're actually working with human beings. And one thing that's happening nationwide is that there are research studies that are being funded, but there are not enough human beings who are participating in the studies. So Trial Match is another program of the association where all of us, anyone, whether you have the disease or you're trying to enroll your loved one possibly, can at least get information about, are there any clinical trials in your area? And we have clinical trials that are being funded in San Antonio that they need people. So what happens with Trial Match, basically researchers put their research study into this database, and then the public can go in and see if there's a match. Or we had a board member who, her mom actually got a match for possibly participating in a research study in Austin, and so they made that decision to drive mom to Austin to participate. So research isn't some kind of far off thing. It can be very local, particularly in the state of Texas. Anyway, long answer. I can hand that over.
Anyone else have any questions? Yes.
I noticed that this morning that it's very difficult to get a diagnosis from pretty much any doctor for dementia or Alzheimer's, but yet it's critical for them to give you a diagnosis so that you can catch it early and try to slow it down or anything like that. So how do you balance that? I mean, especially being a caregiver.
Well, if you're seeing a patient for the first time, I mean, if you've known the patient in the family for a while, it's different. But you're seeing a patient for the first time, the family has concerns. If they want to participate, there's a few things you can ask them right then. Ask them to spell world backwards. If they can't do that, that's room for more investigation. Or do serial subtractions from 100 by 3 or 4. Now, if they're illiterate and never worked with numbers, it doesn't work. I've had patients like that. You spell mundo backwards, but that's where you get, and if they can't do that, then you have to start on that track. And I like to share these things with neurologists too. I mean, the more people in this, the better. You don't make that diagnosis in the first visit. So, you can certainly begin. It's not that hard. If they can't spell world backwards, I mean, we got to look at what they can do and then see if they can remember things, or give them 3 articles. Say, I'm going to ask you in 5 minutes, cat, orange, and car. Can you repeat those in 5 minutes? And if they can't, well, that's the first clue. That's not hard.
And especially in some community programs, like I'm a nurse for the state, but we're seeing now a lot of denials for what's called medical necessity in a program called community-based alternatives, because they are looking at what is the cognitive diagnosis for this patient not being able to take their own medications, do their own care, but they don't have one because that doctor has not given one, so they're being denied access to these programs.
Well, we can use terms like cognitive decline, and that carries less stigma, and that's okay. There's a lot of different classifications now. I mean, 50 years ago, there may be a book that thick of disease classifications, but now it's that thick. So they've broken it down. You can find a classification for something that is socially acceptable and easy to move along. Cognitive decline, or altered mental status, things like that. But the big A, nah, not right away, not on the first date.
I think that's true. I think the other thing is, depending on where the family's at too, if you're trying to look at something like calling, community-based alternatives, then I think it's important to encourage the family to get to a neurologist or a neuropsychologist. Now, there's not very many neuropsychologists around as much as there are psychologists. So I think we only have like 3 neuropsychologists in San Antonio. But a neuropsychologist or neurologist can help make those diagnoses. But I think there's something else to consider that's kind of an ethical question. If in the early onset, if you get that dementia diagnosis, once that diagnosis is in the medical record, it means a whole lot of different things for that person in regards to their life and what's about to happen. If they're still functioning and they are still living at home, you don't want to put that diagnosis on someone that, I don't know if I can say this correctly, but they're not ready. I mean, but if you're looking for community-based alternatives or inpatient or obviously a memory care center or home health or whatever it is you're looking for in that sense, or even hospice if it comes to that stage, then to get a definitive diagnosis, I think you can do that. Now PET scans are where you're getting a lot of that definitive diagnosis with dementia. The PET scans, they're expensive, but they're using them like crazy right now. The other thing is the neurologist, and then I think a neuropsychologist would play a part in that as well. And I think you have to have that conversation with your the family and say, what is it that you're looking for? If they go in there and say, I just want to know what's wrong with mom and why she keeps acting like this. You know, that's a little bit different than we're trying to make plans for her future and her living arrangements and those kind of things. And long-term care, that's different. So I think it's important to get that information. But I don't know, I mean, how many neurologists there are in town, and none. That's what I was thinking. Right as I was about to say it, I thought, oh man, I bet there's none. But there are geriatricians in town. So then it falls on family practice and internal medicine. It falls on family practice and internal med physicians to kind of make that diagnosis. And I think, you know, like with time, I think you're going to be able to kind of get that diagnosis. I think some people are uncomfortable with it, but I think it would be worth the trip to San Antonio or somewhere to get that done. I think it's worth it to make that happen. And get Alzheimer's, call them for referrals, and they'll give you a list and kind of go from there. Or your physician might know someone too who he or she can refer you to.
It's also, I will say, just let's say San Antonio and Central and South Texas, we're also in a little bit of a unique position because we're not overabundant in resources in San Antonio either. So sometimes we'll get families who call, we'll get helpline calls, or our national office will call and say, how come you don't have a diagnostic center in your database that we can refer people to go to, like your sister chapters in Florida, where you can literally go to a diagnostic center, one-stop shopping, go in, and there's all these things under basically one ceiling, and it's a diagnostic center for Alzheimer's and dementia. We don't have that. So it's tough even in the big city of San Antonio as well.
Is there one in Houston or Dallas?
In bigger cities,
Yeah.
yes.
Houston,
And
Dallas,
and particularly through research centers, which are often associated with universities. There are Baylor, etc. I think also, just speaking personally, I didn't think that this would, you know, I would think I would have the resources to be able to get this done, but the other part of it is my mom is still cognitively clear enough that she's having none of this, none of it. So I have to lie, i.e. therapeutic fib, to get her in the car to get her to a doctor's appointment, because otherwise the answer is no. Do you want to do this? No. Do you want to go this? No. We better do this. I think this is urgent and important. No. So there's also that barrier of she's not going to walk in and have, I mean, if someone were to ask her right now, spell world backward, I'd be afraid of what she would say in response, because she would be, oh, don't even think for a second that I can't do that, or how dare you. So that's also been a bit of a struggle. I'm just going to keep persistently taking her to doctors who do specialize, and they can clearly say she has dementia, but can't break it down enough to figure out which one. So that's also, I think, plays a part.
Yeah. So I've been tricked before, because the daughter brought the mom in, and I didn't know the mom was like really good with numbers. And so she was great with numbers. She was better than me. And okay, so let's think about 6 or 12 months later, finally other things started to show up. So you really can't do it just on one test. And then the other thing was validation. You talked about validation. Well, Paige Smith, the author of articles on some really good things, but one of his books was Old Age is Another Country. And he wrote articles in the Chronicle about aging. And he said older people, he was talking about dementia, older people like to talk about their past, to validate their existence now. So we didn't understand that when we were younger. Oh, Mom, what are you telling me that again? You know, I've heard it a million times. But it's validation. And then there's the way you used it, it's an excellent tool. You know, it's validation. That's how you connect. But that's why they're talking. You know, it's important. That was the one.
And even before we grow older, as we're aging, I mean, think about the people that you live with or your friends or family. You tell them the same stories over and over again. You don't have dementia, but you think it's cool because they're funny stories. You're doing the same thing. You're validating your existence. So, I mean, and that's without the dementia. So you can imagine the story you're going to tell when you do get older.
I feel sorry for you.
I mean, how that's going to go, it's going to go on and on. So you can't separate yourself from that storytelling stuff. And the other thing is, there's a small thing so far, is not so much dementia, because it's not as hard to do. But with growing older, we don't really spend a lot of time creating new memories. And so, or making new friends. And maybe you don't need any more friends, because the ones you have already bug you too much. But maybe just creating new memories for yourself as you're aging, even now in life, doing something different you thought you'd never do, going somewhere you thought you'd never go, just anything, you know, trying to grow a plant that you thought you'd never try to grow this type of plant. How many years you've been saying you'd like to get a little vegetable garden in your backyard and you haven't done it yet. I mean, all those kind of things you haven't done. So now you have something different to talk about. You know, do you know what I'm talking about? Creating those new memories for yourself. So I'm challenging yourself to do something outside of that box that you live in and do something different outside of your policy and procedure manual. You know, we all have a policy and procedure manual, and it's hard for us to get outside of that, so trying to do that as well. It's a little bit more difficult with dementia patients, but validation really works significantly well. It actually works well for all of us. We all like that. We need that validation for a lot of different reasons.
Yes. One of the things that I do at Morningside for Learn is I write blogs. And what that's allowed me to do also, I write blogs that usually lead to one of our videos to really promote it a little bit. But one of the things that I've been able to do with that is also write a blog about my mom. And it's called Chronicles of Caregiving, taking care of my older mom. And so what that does is, since I spend almost every weekend with her, because I take her to church on Sundays, my sister and I do, I chronicle about the things that she does, like the time we went to Target and she left her purse. She put her purse down and, you know, she uses a huge purse, you know, I don't care. When she was younger, she put everything in there, from snacks for us at the movies and everything else. But, you know, as she grew older, she really didn't have a need for a huge purse. But she still carried this huge purse. Well, she can't maneuver the purse, the cane, and the basket, so she inadvertently left it, and of course she panicked when she realized she didn't have her purse. We found it, thank goodness. But she gives me a lot of material. You know, one of the last blogs that I wrote was about her parrot, Panchita, that she lost. It flew away after almost 20 years. But anyway, that not only provides some information, but it also feeds me. It helps me to write down those stories about my mom and the things that she does. And you would be surprised at the number of responses that I get from people saying, wow, that's exactly how my mom is, or that's what my mother does, or I can't believe that. So again, I think it's good therapy for me, but it's also helping others to recognize that as well, to relate to it.
journaling, I think, is really good, and that's kind of something like that. So that's really good.
Or just getting a tennis racket, hit it really hard against the couch. Spending time with me too. Using all those cuss words you were told to never use, and do it in private, no one has to hear it. And just hitting that as hard as you can while you scream. Actually, I want to just say that scream therapy, yell therapy, not with someone else, but in the backyard or in the shower is really helpful. In the car, just scream. Or put on the saddest movie you can think of and watch it until you just cry your brains out. And that really helps a lot. Watch The Notebook. That'll just get it.
A couple of days ago, I heard an Alzheimer's Association commercial.
Okay.
I want to make sure that I heard this correctly.
Okay.
Because I thought it was so funny. And I thought, I bet you there's going to be a lot of people who will get to your organization that we never have before just because of this advertising campaign. This is correct. Alzheimer's Association. We are the brains behind you not losing yours. Is that correct?
Yeah. We're the brains behind saving yours.
Saving yours. Okay.
So the reason for, and I will be honest, we've had a couple people go, how dare you be so, I mean, that's a big statement to have. I'm wearing it, and I'm not a researcher or a doctor or anything, but what I represent is the largest contributing organization to the research of Alzheimer's disease and finding a cure, the largest other than what the federal government puts toward Alzheimer's research. So that's why, as an organization, that's really a fairly new tagline that we're using. That, well, I'm so glad, yeah. And the reason is just basically because, unfortunately, here's the thing. When I always think about cancer, because I've been a donor and a supporter of the American Cancer Society for a long time. It's over 100 years old. Now there are lots of other cancer nonprofits, but most people have heard, I would say, have heard of the American Cancer Society. Whereas every day we meet people who have lost someone to Alzheimer's disease, who are in the middle of it and just going through incredibly difficult times, and I have no idea that this nonprofit entity exists, because it's only right around 40 years old. Well, that is considered young in the life of a nonprofit organization. So not only do, one, they not know that these associations exist, two, they don't know what it does. So when we talk about the different support programs that it does, we also, it's always really important to point out that when we raise money, a significant chunk of it goes towards funding research. And what that actually means is it gets funneled through our our national office, and they have a scientific advisory board, and they give out grants. So researchers, young, old, American, from Sweden, you name it, they write, that's how research, they write in grants, and then the Alzheimer's Association actually funds those. So we even have one scientist in San Antonio who gets funding from the Alzheimer's Association. It doesn't come through our little office, but it comes through the whole organization. So that's kind of the reason for that tagline, is that ultimately that's our goal, to fund enough research to find a cure and to lower the death rate. So I don't know if this was covered today, but I'll just throw out a few numbers. Cancer gets funding from the federal government at the tune of $6 billion with a B. Heart disease is somewhere around $4 billion. AIDS is somewhere around $3 billion. Alzheimer's disease gets just crossed over the 500 million mark for what it gets funded. So the reason for that is not to compare Alzheimer's to other diseases, but it is to show, and we have a great handout, I don't think we have it, that death rates from other diseases are all on a decline. Because of the amount of research that now you can have a treatment, you can live, you can prevent, you can cure, you can stop it in its tracks, whereas the trajectory of Alzheimer's disease deaths are just, it's 66%, so just skyrocket, while others are a young baby nonprofit, has raised more than $300 million between all of our chapters and donors to fund research. So we're the largest contributor of research other than what the federal government does. And that's not nearly enough. So we're kind of pushing at it from all ends. That was another really long answer, but that's why. Yeah, thanks. That's good.
I have one question. When you were talking about the brains this morning and how they operate, the books that you were reading, you mentioned something about reversal with some strokes, that there is some possibility of reversal on getting the connections going. Would there be more information on that on the website?
Yeah, there are. Neurogenesis has been proven in animal models, and also size increase in human brains has been proven with certain exercises. And you can look at the Amen clinics for that. Dr. Amen makes a case for actually either recruiting new neurons or actually increasing size of a certain part of the brain with a certain program. And he can do that, and he can show it on his single photon emission CTs. And that's cheaper than a PET scan, and it's very reliable. He's done 90,000 of these now. He has the largest database for what's normal and what's abnormal. You missed that one. That was Frankenstein. Abnormal. Which brain shall I take? You know. Well, there's just abnormal, but the guy reads it as abnormal, so they get the wrong brain out and put it in the guy. Anyway, so we can definitely do some wonderful things, and he suggests brain games that you can do to improve your cognition and your attention and coordination. So you can do a lot with brain. It's a plastic. We used to think we were born with a certain number and they just decline. And that's what we used to think. But that's not true. And for every brain cell, there's at least 4 support cells. I told you there was 100 billion neurons. Well, those are neurons. Those are thinking. There's 4 kinds of glia cells. Those are support cells. There's 4 to 1 for every single neuron. There's 4 more, support cells that don't do the thinking. They just keep the brain healthy. And then there's 40,000 synapses for every neuron. So it's like there's a lot of redundancy.
So games you could possibly start increasing those connections.
Yeah. And when the brain gets to be about 12 years old, if those circuits aren't used, it starts pruning certain synapses. So if your child's taking violin and music lessons, early on, 10 to 12, he's going to have more synapses. But you have to do it, because by the age of 12, the brain starts pruning the circuits that aren't being used. The greatest learning ability is in those years. Yeah.
But now, what if you have somebody that's older, above 50, that has one? Does that mean
you can improve function. Okay, Dr. Amon already showed in men, women, they don't need it. In men over 40, 2 cups of green tea improves brain activity in men. Women, they're fine until the estrogen goes down. But there's things you can do.
My beard comes up.
Well, women can generally outthink men anyway, so it's like, yeah. You never argue with them.
As he says,
Men think in straight lines. Yeah, women can just jump around concentrically. They can change track. You never know. But the brain is receptive to what you're doing, So you just feed it good stuff and it'll grow.
with the blueberries?
Brain berries, yeah. Yeah, in rats for sure. We don't do those experiments because they're not ethical in humans, but I'm betting on the rats. Yeah.
I
I recently started taking guitar lessons. I always want to learn how to play guitar. And man, it's really hard. But I can read music because I played in high school band the saxophone, but of course guitar is completely different. But I always wanted to learn how to play. And those are the kind of things that I can tell now that, you know, that it's made some changes. But I also play video games all the time. So because I read somewhere that video games were really tremendous for hand-eye coordination and quick thinking.
Dr. Amon has serious concerns about video games. As an adult, you're mature.
Yeah. Oh no, I'm not stuck. Yeah.
But
I'm not 10 and playing for 7 hours.
Yeah, that constant reward.
I'm 24 and playing.
Yeah. It's dangerous in certain, you know,
age groups.
That's it. Yeah. So.
They have that website, lumosity.com. For the red days.
That's good.
Yeah, it is.
For Dr. Lozano.
Yes.
You mentioned in your presentation this morning that you had run across a place where there was a comparison of cost for care.
Long-term care.
Mm-hmm. And
I know now what it is. It just came to me. Thank for that guitar lessons. Genworth, GEN. Genworth is a life insurance company. They do a tremendous amount of research on long-term care, just cost for, because they're trying to sell long-term care insurance, which I'm a big believer in, by the way. But anyway, it's called now. Yeah, now. But it's called Genworth, and just put in Google Genworth long-term care costs, and on that site you'll see a link for long-term care costs in the United States, and this whole big old map of the U.S. comes up, and it allows you to hit any state and talk about costs. It's very interesting. And it's actually just came out like a couple months ago.
And this is the same place that you could get some comparisons about the individual costs as well, and how to cut those costs.
Individual cost of what?
Of the care.
Yes, that's available on that site as well too. AARP also provides some of that information as well too.
Who?
AARP.
Cancel my membership.
Well, you can still get on the you can still get on the internet though with me, and it'll probably say for members only on some, but just call me, I'll help you out. I'll charge a little less than AARP does.
The company of Genworth heavily supports the Alzheimer's Association as
Yeah.
a national sponsor because they talk about more than 50% of all their insurance claims, person has Alzheimer's disease. More than half. They're overwhelmed with the numbers, so they.
It's very expensive.
I want to say a few words. My wife is in a memory care unit at such a place here. Has been for a year and a half. Before that, 2.5 years in nursing home, self-paid. And I've been her caretaker probably for 4 years before that. Could not get a diagnosis for Alzheimer's up until the time I checked her into the nursing home, and my doctor, our family doctor, finally agreed with me that there was something more than just dementia there, or one of the kinds of dementia. He agreed that it was Alzheimer's. I have, I lived through this family care, personal care, caretaker part for 4 years, and I know how difficult that is. Then I got some help, and that wasn't enough either. So that's why I had to check her in someplace that could give her full-time care. I'm very pleased with the care I'm getting at the memory care unit here. Very pleased. Country Living has made her comfortable and made me comfortable as a result. I'm not a commercial, but it is something that I really care about because I liked it so much that I checked myself in to the assisted living place and have been there for over a year. It's important for me to know that this research is going on, and it's important for me to know how I can help make it go on, which I'm sure is very low. I'm 79 years old. 3 years ago when I checked her in, after I checked her in the nursing home, I was diagnosed with advanced prostate cancer. And I wanted you to know, Dr. Lozano, that I have some problems not with estrogen, but with whatever it is, male testosterone, because in order to slow down that cancer, I'm taking female hormones. And I want you to know that my boobs are bigger. The fat growing around my tummy has grown significantly. And it's really working well.
Well, you're living.
Except my libido with the foot.
Well, that's what we use. You were saying, remember there were some issues about sexual.
Yeah.
Well, we had a patient like that in California, a nursing home, and one of the nurses suggested, gotta listen to the nurses, okay? They're where the rubber meets the road. Let's try a little estrogen. Well, if you don't tell anybody, we'll do it. Hey, a little bit of estrogen cooled his jets. He became a nice citizen. Worked out. And that's what we did in California under, without saying anything.
Well, next time I go to Walmart to get my mother some underwear, I'll pick up a bra for you. Thank you for sharing that. But I do think that, especially being I know you're a veteran, and there's some financial benefits to that too. Are you aware of that?
I have checked into that, and I'm with
with the VA, with the assisted living. Yeah.
I'm 100% disabled. I'm a retired Major General too.
Yeah.
And so.
Thanks for coming.
Yeah. You said Major General. I got you.
But I'm not complaining. I'm very proud that I get the care for her that I do, and I'm very happy that I can afford it. There are those that cannot, and I guess I pray more for them than I do for myself.
Yeah. The cost has just become it's unbearable, and I'm hoping that that somebody's going to pick that up in legislation. Be careful who you're voting for. Pay attention to people who are supporting some of those bills, and we need to start looking at something different for that long-term care cost, and not only at facilities but at home, and some of that support for caregivers financially, because the economic burden is part of just the emotional and mental burden for a lot of caregivers.
Thank you very much. I'd like to say one final thing. I appreciate very much you taking the time and the effort to come in and go through these wonderful discussions that we've had and presentations that we've had. I want you to know that I've been to several of them, and I think this is one of the best I've been to. And I appreciate you all very much for being here today.
The only thing I want to mention is I had, at the desk where all the handouts are, our Hope CRCG had done a resource list, a local resource list. So I made copies of that. They're laying over there on the table if anyone wants to take that. It's just a quick reference for the different resources in the community.
Well, thank you guys. I know, Joe, if you want to say a few more words about CEs and on behalf and surveys, please in your notebooks there's a lot of paperwork. We realize we loaded you up with paperwork, but there is a confidential survey front and back, and it's from the Alzheimer's Association. And it's just we really really do want your feedback to know how to improve things and what you liked, what you didn't like. I will say this, the last question I think on the bottom always says, what would you like in the form of education next time? And sometimes we get information, well, we want to learn about cancer next time, or we want to learn about diabetes, and what that question means is in relation to education and Alzheimer's disease, what other things would you like for the next go-around? So anyway, thank you for filling those out, and please make sure that you grab a brochure. Again, thank our donors and underwriters with their information. Make sure you grab a brochure of the association, because our phone number is on the back of all of them. Call anytime, and anything. Again, thanks to Joe and Mark and Maxine for all of your work, and turn over to Joe.
Thank you. Concerning CEUs,